Hi everyone, this is Dr. Merhaut with Elite Sports and Spine. I'm here with Dr. Keklak. We're going to be going over foam rolling for the back as well as the upper extremities today. Last week we did lower extremity foam rolling, so if you haven't seen that one, please check out last week's video. But to get things started off with foam rolling for the back, we're going to do lumbar spine, so low back, mid back, and the thoracic spine, and then all the way up to the cervical spine and a couple muscles through those areas. So to start things out, Dr. Keklak is going to start with the lumbar spine. So this is where the tailbone starts and then all the way up through this region right through here. So just by kind of sitting on top of it and then rolling your butt towards your heels, we'll get that region of the lumbar spine. Moving up to the thoracic spine, if he crosses his arms right over his chest, make sure that the chin is tucked a little bit so your head's not falling backwards, you're not straining muscles in your neck while doing this. And then just going through that mid portion of the back from where the lumbar spine stops and thoracic spine starts all the way up to the shoulder area where the top of the thoracic spine is. This is usually the area that people get most relief with foam rolling. The erector spinae through the middle of the spine is often tight and tense. And then also sometimes people just have a lack of extension through their thoracic spine. So this helps promote the extension in those areas. If you want, you can localize each section and each vertebra just by extending a little bit into that area and then moving up and down the spine and noticing areas that are a little bit more restricted, focusing a little bit more time on that. Moving up to the neck and the cervical spine, sometimes a little bit of a delicate area, so don't apply too much pressure in this area. It can be a little bit tense and tender, but just literally moving back and forth about an inch or two, 3 to 4 inches max across that cervical spine. Sometimes when people have headaches that are associated with suboccipital tightness, the tension, headaches in the back of the neck, and start and wrap all the way around to the front. If you just lie your head like he is right now, on top of that, going back and forth, nodding your head yes, and nodding your head no back and forth will help release those muscles. This one is actually one that feels really, really good and can do a lot of great work if you get those tension type headaches. Moving on to the lats, so upper extremity type stuff, we're going to be working a little bit area into the lat here. So he's going to go on one side, extend his arm out, and then use his arm and his leg to kind of push back and forth through that area, going up all the way into the armpit and just rolling like you would any other body part. You can do this on both sides. You'll figure one side's probably a little bit more tense than the other. And then we'll switch over to the pec. So pec minor is often a muscle that rolls the shoulders forward. The upper cross syndrome, which is a thing we talked about in a previous video. So if you watch him extending the arm, working that front of the area from where the pec attaches into the arm all the way into the chest area. So again, doing that on both sides, figuring out which one's more tight. Moving on to, we're going to go to the wall next. This is also an area or a stretch that you can use to stretch out those lats again, but using the wall itself. So he's going to place that foam roller on the wall and go straight up into that area. If he wants to do one side at a time like he's doing right now, you can do that. If he wants to do both sides at the same time, you do that, as well as working through the thoracic extension. So once he gets to the top, he's dropping his chest closer to the wall, and you'll feel that stretch all the way through there, as well as some motion and mobility through the thoracic spine. And then last one, what we'll show you, since we went over foam rolling the pec area, is we'll go over to a doorway. We're going to show you a doorway stretch for the pec minor area that's oftentimes really tense for people that have upper back pain, neck pain, because their shoulders are rolling forward. So if we go over to this doorway, Dr. Keklak's going to place his arm into it. He's going to step forward and lean away from the area of where his hand is, and you'll see that that will stretch everything through this area right here. So great pec stretch there. This is the Elite Education series. Thanks for tuning in for this week's series of upper extremity foam rolling, as well as the whole back foam rolling. For next week, we have something exciting for you guys. Lost you for a second, but let me show you. I'm going to flip the camera around. We got a new piece of equipment. If you follow us on Instagram and Facebook, you've probably seen this piece of equipment, but it's called the Vertimax. So I'm going to flip around right now. This is a piece of equipment. It is awesome for personal training purposes, increasing vertical agility, strength. So we're going to demonstrate next week. If everything's up and running in the gym next door that we're putting in, we'll take the piece of equipment over there and show you some stuff over there. If not, we'll be utilizing it in here. So stay tuned next week as we introduce our new Vertimax. I'm Dr. Merhaut with Dr. Keklak. Thanks for tuning in.